The cause of death was listed as undetermined due to a lack of visible trauma or signs of struggle. The medical examiner disagreed, emphasizing that no physical evidence was collected at the scene. That absence itself became evidence, leading investigators down a different path. Forensic toxicology revealed the presence of an undisclosed poison in the deceased's bloodstream. This finding prompted further investigation into potential environmental and occupational exposures, as well as the possibility of deliberate poisoning. The medical examiner meticulously analyzed tissue samples and conducted a comprehensive review of the victim's recent activities to identify possible sources of contamination. As the toxicological report confirmed the presence of a lethal dose of thallium in the deceased's blood, questions arose regarding its origin and administration. This episode delves into the meticulous process of detecting and identifying this rare poison, revealing how subtle clues can unveil the truth behind a seemingly ordinary death. Chapter: Case Background. The incident under investigation occurred in a residential apartment complex located in downtown Seattle on October 15th. The discovery of the deceased was reported by a neighbor who became concerned after observing no activity from the unit for several days and noticing an unusual odor emanating from it. Upon entering, the individual found the body in the bedroom, with signs indicating that the deceased had been lying motionless for some time before being discovered. Initially, local emergency services were contacted to assess the situation. The scene was cordoned off pending a thorough investigation by law enforcement and forensic teams. Preliminary observations suggested natural causes due to the absence of any obvious external trauma or signs of violence at the site. However, given the peculiar circumstances surrounding the discovery, including the presence of an unusual odor, toxicology tests were ordered to further investigate potential poisoning. Subsequent analysis revealed the presence of a significant amount of an unknown toxin in the deceased's bloodstream, prompting a deeper forensic examination into possible sources and methods of ingestion or exposure. Chapter: Initial findings upon arrival at the residence. First responders noted the deceased lying supine on a bedroom floor, surrounded by scattered personal effects and an overturned table. No visible external injuries were observed, leading to speculation of natural causes based on the absence of trauma. The initial medical assessment revealed no signs of recent activity or struggle, consistent with a sudden onset event. The scene presented no obvious sources of mechanical injury. However, a partially consumed bottle of medication was found nearby, prompting suspicion of potential poisoning. Given the lack of immediate signs of distress and the presence of unopened windows, carbon monoxide poisoning was considered but deemed unlikely due to environmental factors. The manner of death was initially classified as undetermined pending further toxicological analysis. Upon detection of elevated levels of an unknown substance in blood samples drawn at the scene, forensic toxicology was requested to identify the precise nature and quantity of toxins present. This finding necessitated a detailed autopsy and laboratory tests to confirm the cause of death by poisoning. Chapter: Forensic Investigation. Upon arrival at the residence, investigators secured the premises and initiated a thorough search for potential sources of poisoning. Physical evidence collected included an empty vial bearing residue, consistent with traces of strychnine, located on a countertop adjacent to a partially consumed bottle of water. The deceased's personal effects were meticulously documented, revealing no immediate signs of forced entry or struggle, suggesting the presence of a known substance. Blood and tissue samples were extracted from the body for toxicological analysis. All collected evidence was placed in tamper-evident bags, with each item labeled according to standard protocols, ensuring an unbroken chain of custody throughout processing at the forensic laboratory. Notably absent was any medical documentation that might have explained the presence or administration of strychnine. The laboratory analysis included comprehensive toxicological screenings to identify potential toxins in the deceased's blood and tissues. Gas chromatography mass spectrometry, GCMS, was employed due to its high specificity for organic compounds, while liquid chromatography tandem mass spectrometry, LCMS/MS, was utilized for quantification of drugs and metabolites with low detection thresholds down to 0.1 ng/ml. The laboratory analysis included comprehensive toxicological screenings to identify potential toxins in the deceased's blood and tissues. Screening panels were tailored to detect common poisons such as organophosphates, heavy metals, and alkaloids. Tissue samples from the liver, kidneys, and brain were analyzed for distribution patterns and bioaccumulation. Histological examination revealed hepatic steatosis consistent with acute poisoning. Microscopic analysis identified renal tubular epithelial cell necrosis indicative of toxic insult. Quantitative results confirmed a blood concentration of 250 ng/ml of strychnine, surpassing the lethal threshold of 100 ng/ml. These findings supported a diagnosis of fatal strychnine toxicity. Analysis of the toxicological samples revealed the presence of a potent neurotoxin in the blood of the deceased, consistent with acute poisoning. The sequence of events was reconstructed through an examination of time-stamped digital communications and surveillance footage from the vicinity of the incident. These records indicated that the ingestion occurred approximately 4 hours before the onset of symptoms, corroborated by the postmortem interval estimated at 5 to 6 hours based on gastric content analysis and body cooling rate. The timeline confirmed that the deceased consumed a liquid containing the toxin during a social gathering shortly after midnight. Contradicting earlier reports suggesting a suicide attempt, the evidence did not support self-administration, but rather indicated possible coercion or deception by another individual present at the event. This reconstruction highlights the importance of corroborating witness statements with objective forensic data for accurate sequence determination. In the analysis of toxicological samples, the presence of a specific poison in the deceased's bloodstream establishes a definitive link to the cause of death through laboratory identification techniques such as gas chromatography and mass spectrometry. This reconstruction highlights the importance of corroborating witness statements with objective forensic data for accurate sequence determination. These findings confirm the toxic agent was ingested or administered prior to demise. The concentration levels provide insight into the timing and manner of exposure. Expert testimony would articulate these results, highlighting the absence of other contributing factors and reinforcing the poison's role in mortality. Areas requiring interpretation include estimating the exact time frame for ingestion based on blood concentration curves, while forensic evidence, such as residue analysis, offers more concrete conclusions regarding the method of administration. The expert would affirm under oath that the toxicological report unequivocally identifies the causative agent, but acknowledges limitations in precisely correlating symptoms with exposure, timing without corroborative medical records. Chapter Resolution. The toxicology report unequivocally identified the presence of strychnine in the blood of the deceased, a finding that conclusively altered our understanding of the cause of death from suspected natural causes to intentional poisoning. The expert would affirm under oath that the toxicological report unequivocally identifies the causative agent, but acknowledges limitations in precisely correlating symptoms with exposure, timing without corroborative medical records. Initial assessments were inconclusive due to the absence of clear external signs of trauma or substance ingestion, leading investigators to focus on cardiac and respiratory anomalies as primary determinants. However, meticulous analysis of biological samples by forensic toxicologists revealed strychnine levels well above the lethal threshold, indicating a deliberate act. The identification was corroborated through comparative analyses with known poison profiles and verification via multiple testing methods, including gas chromatography mass spectrometry, GCMS, and liquid chromatography tandem mass spectrometry, LCMS/MS. However, meticulous analysis of biological samples by forensic toxicologists revealed strychnine levels well above the lethal threshold, indicating a deliberate act. This interdisciplinary approach ensured accuracy in the final determination. The presence of strychnine confirmed a toxicological cause for death, marking a significant shift from the initial medical examiner's report, which noted unexplained symptoms indicative of respiratory distress. The resolution underscores the critical role of comprehensive toxicological evaluations in cases where poisoning is suspected but not immediately apparent, highlighting the necessity for thorough forensic methodologies to uncover definitive evidence. This case underscores the critical role of comprehensive toxicological screening in identifying non-visible poisons, highlighting the necessity for meticulous sample analysis and cross-referencing with historical medical records. It reinforces the importance of multidisciplinary collaboration to establish causality and context. The file remains open,